We are Team T, and we want to bring innovative and affordable psychological help to people living with anxiety. But before I introduce you to our product, MindTrack, I would like you to meet Alex. Alex is 30 years old. He's a very ordinary guy, and when you meet him, no red flags will be raised. But on some days, even if you're his colleague or a friend and he spots you passing by, he will take another way. Other days, he won't come into work when there is an important event. This has already cost him getting a promotion or going after the job he's been dreaming of. He will also avoid your birthday party, not because he doesn't like you, but because being in a crowd, or even worse, in a spotlight, makes him feel like 1,000 needles are getting stuck into his skin. Yes, Alex has an anxiety. But worst of all, you will never guess that he wakes up every morning with dreams and wishes he can only suppress, as he has no power to stop hiding and pursue what he's definitely capable of. So, what can we do to help Alex? MindTrack is a service that will allow Alex, me, and you to tackle our fears and anxiety under the supervision and with constant help from a professional therapist. It is a new, more cost-effective method to delivering of individualized treatment. It combines online therapy sessions with sets of personalized resources and activities. The end goal is to help the user stay on track, to stay motivated, and incrementally improve their well-being. According to official data, there are 125,000 young people living in Bosnia that are likely to have some sort of an anxiety and also likely to be willing to pay for an online help service. That means that there's a market out there worth 30 million euros in Bosnia only, or 88 million euros if we include Serbia and Montenegro, where we plan to expand.
With so many apps and services already available out there, why should anyone use MindTrack? First of all, our tracks are completely science-backed and include widely used CBT techniques. Secondly, our tracks reduce the number of therapy sessions that you would usually need, as well as reduce the amount of money that you spend on your well-being. MindTrack is online, therefore it is time-saving and available to people living in rural areas or small towns where professional help can be found or where people are afraid of being judged by their environment. What sets us apart from our competition is that we are both affordable as well as offer professional guidance. What is even more important is that MindTrack is offered in the local language, contrary to most of the competition. MindTrack isn't designed just for individual users, but also offers packages for businesses that care about their employees. In our B2B model, we are creating tracks that will target work-related issues such as burnout or stress handling. In our B2C model, the users pay 20 euros per month and get their own personalized track and one therapy session with their therapist. Our plan is to reach 80,000 euros in revenue in the first year. After the initial investment, we break even in the 9th month and plan to have a steady growth in the following years and expand to Serbia and Montenegro. Our MVP is ready and contains a general anxiety track. Our next step is to add personalized tracks for individuals and business tracks. What we need is additional 7,500 euros to finalize our product and launch it into the market. We plan to invest this money in marketing, research, and finalization of our product. Our end goal is to reach 50 premium users and 1 business user at the end of the 3rd month after our launch. I'm sure that you are wondering why we believe in this. On our team, we have IT specialists and economists. We also have medical doctors and psychologists, and we are sure that we are capable of helping others achieve their maximum. Now, I'm already sure that you understood the need for a product like MindTrack. I would like that you ask yourselves, do you sometimes feel like Alex? Or do you know somebody like Alex? If yes, then invest in us and help us stay on track. Thank you very much.
Okay, thank you very much, guys. I'm going to pass it over to our panelists now, investors, to ask any questions they might have. We have approximately 5 minutes for that.
Just a quick question, Eddie. I cannot find MindTrack on my group. Which group is it on the left? On the sheet.
It's
the first group.
The first.
It's first group on your. Yeah.
I am Ed. That's the one.
So,
okay, the first group. Anyways, I don't want to take time. Yeah, I have a problem. I mean, this is a great presentation. Thank you, and I'll definitely be interested in talking to you further. The problem I have with your estimate, you said 125,000 young people in Bosnia alone who would be interested to pay for these kind of services, knowing that there are only 177,000 youth in total in the entire country. How did you come up with the number of 125,000? Thank you.
Amar, do you want to answer this question, please?
Yes, of course. So we took the amount of youth people that we have in Bosnia Herzegovina and took the results of the surveys that we conducted with a significant number of young people and came up.
There are, we took first the number of people between 15 and 30 in Bosnia, then we used the global estimates that 1 in 4 of them, 1 in 4 global population has some sort of anxiety and mental health problems. Then we used our survey, which is not, of course, with all of those people, but we got that 67% or something said that they would be really willing to pay for an online help service. That's how we came from 800,000 to 125,000.
Okay, thank you. I'm going to go to the next question. I believe the next hand raised was Adnan Berberovic. Adnan, you're next.
Yeah, thank you, Eddie. So first of all, thank you for a great presentation, really one of the better ones that I've seen so far. So I just have a question. If you would address what would be your major challenge to be successful with this idea? What would you say is the major challenge for you?
I think the major challenge for us is actually this step. Because first of all, we have the idea we all believe in. We have specialists on our team. We don't really depend on that side from psychological and medical side. But what we do need is time that we need to invest in research and also money we need to invest in it. So that's going to take some time, probably about 8 months. And yes, we need money for that, basically. Yeah.
Okay, thank you for that.
Thank you, Adnan. I believe the next question will come from Christina. Christina, you're next.
Yes, good afternoon, everyone. Great pitch. Thank you so much. Question is, how will your customers find out about your service? How will you reach them?
I would like to delegate this question to our colleague, Alma Basic.
Good evening, everyone. Actually, this is the part of our marketing strategy. The first investment actually will be in marketing after we finish our research and development of our application. And we will do mostly the social media marketing because there is our target group. And also we will try to host on TV and radio stations, but just to explain what is our product, not like advertisement. Everything what we will do aggressive marketing, also social media marketing, because there is our target group.
Okay, thank you very much. I'll move on to the next question from Sanin Saracevic, and then we'll go to Amar Alikadic next. Sanin? Sanin, can you hear us? Can you post your question?
Sanin, yeah, sorry. I think I missed you.
Okay, Sanin,
can you hear me?
Sanin, can you hear us now? Yep. You can go for the question now, Sanin Sarajevic.
All right, sorry, I said great job, guys. Very well done. Actually, I think we're all Alex in this day and age. So a very timely solution. What is the efficacy of lying? Is one of the more important questions. I have quite a long list, but we'll do it later. So how do you improve the efficacy of the solution?
Yes, that's a great question. Thank you. So the efficacy will be measured after actually finalizing our product, and it will be measured over a long period of time. So it will be done by the psychologists that people are working with, but also by self-evaluation. So if someone says after 3 months, okay, I feel better now, I can go and talk to people, that's a pretty good sign that something's working right. So yeah, one of the biggest thing that we're concentrating on is actually that part, not just beautiful UI design, but the actual efficacy. And we're not just hoping it will be really good, because it's based on science. It's based on CBT technique that have been used in research, but also in clinical studies over a long period of time. Yeah.
Thank you.
Thank you very much. Amra?
Yes, thank you very much for the presentation. It was a great one and a very much needed product as well. I have two questions in one. How will you ensure the quality of the therapists and how professional would they be? Have you talked to them? How many have you talked so far? And would the fee of 20 euros per month be enough for those therapists to actually agree to be part of this project? Thank you.
One of the most important things in our product is that we focus on the quality of the therapists themselves. So it means that graduates straight away out of school won't be able to be a part of our team. With this being said, we focus on people that, besides having a degree in psychology, for example, have also had some education in therapy, in some kind of therapy, and that have had a couple of years of professional experience giving and serving that therapy. Regarding the price, we think that price is quite competitive and affordable, both for the end users, but also for the therapists, because they wouldn't have to pay for their own office where they would be with the users. They could do it online, because that's the idea. Also, they would have a broader market. And instead of a therapy session lasting 1 hour, which is the usual duration of a therapy session, it would last 40 minutes.